The International Council of Nurses have compiled a report that found that nurses' pay disputes around the world are undermining the new interest created in nursing as a career because of the pandemic. The study also finds that discontent and dissatisfaction in about 20% of the Council's nurses' associations. Of the other issues that the ICN's national nursing associations are highlighting is the effect of a potential increase in the risk of the migration of nurses. Another study conducted last year found that the pandemic exposed the vulnerabilities of nursing supply flows domestically and internationally. It also found that the impact of country level has further highlighted pre-existing nurse supply gaps and the effect of staffing shortages. Countries like Denmark have received hundreds more applications from nurses outside of the country inquiring about working in the country, and Spain also reported that there's been an increase in Spanish nurses wanting to come back to Spain, especially from the UK because of Brexit. Well, to talk to us a little bit more about this report and the far-reaching consequences of dissatisfied nurses in the profession, we're now joined via Skype by the International Council of Nurses CEO, Howard Catton. Howard, thanks very much indeed for joining us. Always good to talk to you.
Good evening. Good to see you again.
All right, so Howard, the International Council of Nurses is a federation of more than 130 national nurses associations representing more than, I suppose, a significant chunk of nurses around the world. I wonder, with all of the information you've been able to gather, what are the large talking points?
There are 27 million nurses around the world. I think what all of our evidence is clearly showing is that this pandemic has had quite a phenomenal impact on the nursing workforce. We've called it the COVID effect, whether it's been increased infection rates, sadly deaths amongst nurses, the mental health impacts, nurses who are just burnt out and having to leave. And then this most recent study, which is showing that whilst there is an increased interest in some parts of the world in nursing as a career, which is a good thing, that risks being wiped out by poor working conditions, concerns over pay, resulting in strikes, in discontent as well. So it's a mixed picture. But what we really need to do is to make sure that we're investing in nursing pay, nursing jobs, nursing education.
So, Howard, is this something that's deteriorated over time, or has this always been the case? My mum worked as a nurse for years and years and years. I didn't know what her pay conditions were and work conditions at that time. But nursing was a very much aspired to profession at that time. Have things changed in terms of working conditions, or is it just that people have more choices now?
What we've seen is that over recent years, in many countries, there's been a freeze to nurses' pay. After the global economic downturn, we saw this chilling effect on nurses' pay. And then during the pandemic, what our nurses are also reporting is that, again, pay rates and conditions have not been improved. So this isn't just a recent issue. This is a historical issue of undervaluing. But what nurses, I think, are doing now are saying, look, we're demanding, we're asking for better conditions. Yes, there are issues around our safety, our protection, nurses' rights, healthcare worker rights, our human rights. But also, we're just not seeing the value in us as a profession match the rhetoric and match the words. We hear the applause, but the applause without action is unacceptable. It sort of feels like, all icing and no cake.
So who's guilty of underpaying and not dealing with working conditions? Are these the state hospitals? Because I don't know what it's like in other parts of the world, but here we find a lot of our nurses work in the public health system and then they moonlight in the private system as well.
So I think that governments firstly need to step up and recognise that over years there has been this lack of investment, this undervaluing. You know, we often see the average pay of nurses in countries below average pay rate for everyone within a country. Some of those countries in Europe that you mentioned for peace, that's what's at the heart of the pay dispute, that they've got nurses who have being paid not just, they believe, unfairly, but below what the average pay rates are. So there's a historical issue, but that, for me, I think is tied into the fact that we value nursing for its care and its compassion, but we've never really valued it for what it means economically. And the pandemic has shown us that our health systems are intimately linked to our economic freedoms, our abilities to see loved ones as well. It's an investment, it's not a cost. That's how we should be thinking about nursing and healthcare.
So this has, I would imagine, necessarily caused a flow of nurses from much poorer countries into countries that are a little bit better off, even though in those countries they're still not happy.
This, I think, is a really critical issue, that because we're seeing shortages in both high-income countries, middle-income countries, low-income countries, the higher-income countries, because of the need to get staff, to get nurses, as a quick, short-term fix, are looking to recruit from, frankly, often countries who can least afford to lose their own nurses. Countries need to step up to the ethical plate on this. I think that they need to be aiming and striving for self-sufficiency in the supply of their own workforce. Nobody's going to stand in the way of an individual who wants to move for, career progression, and there could be learning and there could be good things that happen as a result of that. But where it diminishes another country's ability to provide healthcare to its people, there are some very significant ethical issues there as well. And we're seeing, the dreadful images that we're seeing coming out of India at the moment. India is a country which historically has supplied nurses to the world, but at this time, be thinking about recruiting from nurses from India seems to me completely wrong to be doing.
So for nurses already inside this system, they can see the issues and they can make decisions about their careers. But young people leaving school, what are they citing as a reason for not wanting to think about nursing as a profession? Because they're not in it. They must be hearing something from somewhere and making up their mind that perhaps this isn't for me.
And this is interesting in terms of this most recent study that we brought forward, that there are some countries where there has been an increase in the number of applications. Probably about 30% of countries we were seeing this increase in interest. I mean, that's a good thing. I think, a lot of people have seen the pictures of nursing on TV in a way that we've never seen before. And if you're looking for a career where you can really make a difference to people's lives and save lives every day, then nursing is a career that you should absolutely consider. But at the same time, we're seeing pictures and hearing the stories of nurses who're not getting the protection, not getting the PPE, these issues about pay and being undervalued. For some, it makes nursing look like a very unattractive profession. When you take the bigger picture on this, I'm talking about shortages in nursing, but we know a lot of countries have lost jobs in sectors like retail, transport, hospitality. There is a way here, joined up our thinking, that we could help people losing their jobs in other sectors to retrain in nursing, in healthcare jobs as well. And that's why we're saying, look, governments, you need to rethink this as well. But bottom line is that you have to put in some investment. You can't just clap and give plaudits. You need to back that up with the money which will support education, good work, fair jobs.
Pay is always one talking point, but I've lived long enough to realize that sometimes it's not even actually about money. Sometimes it's just where you work and how you're treated there. Is that something that's coming through as well?
Yeah, look, absolutely. I think that, pay is an indicator of how societies value you. And for all the reasons we've talked about, I think it's become increasingly important. But the recognition, the respect that you get at work, that you feel listened to, that your voice, your opinion matters, that you're included in decision making, that you've got the opportunity to progress your career, that you have flexible working to cope with, if you've got families or dependents as well, that you can accommodate those within your work. All of these are really, really key factors. I don't think there is one silver bullet on this in terms of, it's just about the pay rate, or it's just about working condition, or it's just about feeling well treated. It's all of these things which are important to both attracting people in and then holding them in the profession.
One of the things that I've experienced in journalism, and I wonder if it's the same in nursing, is that it's quite important to have mentors. Seasoned professionals who've been at it a long time. When you come in, they take you through and they pretty much hold your hand and then get you on your career course. But we started to see senior people exiting before retirement and going into other areas of work. Is that something that's playing out in the nursing profession? And it must be a concern if that's the case.
I think you're describing your mum. She will be she's gold dust. Somebody like her is gold dust. And that's why this issue about retention is so crucial, because when people leave, it's not just about the numbers, it's about exactly the sorts of skills and experience that you've just described that we risk lose and walking out the door. These are, as you said, these are people who bring on the next generation. But they're also the people who, when we're in healthcare, in a hospital or a clinic, they instinctively know when something isn't right. They demand high standards. That they're focused on making sure that everybody's treated as an individual at high quality as well. These are people who, again, if countries think about the fact that treat them as an investment, somebody who for 20, 25, 30 years you have invested in. And if you think about it in that way, then I think people would be much, much, much more focused on doing all that they could to retain those people in. And if those older nurses say, look, I can't work full time, the pandemic is really taking its toll, I need some time out, I need some flexibility, I need some extra support, I think it's the right thing to do for those people who supported us through the pandemic. But actually, I think it makes economic sense, and I think it makes sense for our health systems, the people who are managing our health systems, say, well, absolutely, take some time out, that give you a bit of extra support. And if you come back, you give us another 3, 4, 5 years, then that's enormously valuable. Yeah.
Howard, Catton, we're going to have to leave it there, but thanks very much indeed. Always good talking to you, and good to have these issues highlighted. And let's hope that the authorities around the world step up, because it is indeed a noble profession. Thank you so much.
Thank you. Good to talk to you yet again.
Right.